When it comes to having a conversation about your genetics with your doctor, the first step is actually going to be with you in terms of learn about your family history, find out what types of cancer are in the family, and then share that information with your doctor. Your doctor may say, those are totally normal cases. That's what we expect to see. Unfortunately, cancer is common, and the amount that's in your family is kind of what we expect to see. You don't really need to worry about genetics. But if you're concerned, you can ask for more information. You can ask for more details about what do those cancers mean for you in terms of risk. Do those cancers indicate that there might be something genetic? And some doctors are going to feel really comfortable answering those questions for you. Others may not be as comfortable, and they may want to refer you to a risk assessment specialist or potentially a genetic counselor. Now, for your own knowledge, what are the red flags that should really make you and your doctor think about genetic testing or seeing a genetic counselor? You're going to look for those things in the family that make you scratch your head in terms of the cancer cases. So cancer younger than expected. So for example, breast cancer in the 30s or early 40s, colon cancer in the early 30s or 40s. Any case of ovarian cancer could flag or should flag for genetics because ovarian cancer is a relatively rare cancer. And we know that at least 1 in 10, maybe 1 in 5 cases of ovarian cancer are due to genetic causes. So any case of ovarian cancer is a red flag. If there's another rare cancer, like a male with breast cancer, someone who's had cancer more than once, 2 separate cancers, not one spreading to another body part. Or you just have a lot of cases, your mom, your grandmother, your aunt, your uncle, your sister, those types of things that just make you go, there's way too much going on here. It's too young. It's a weird cancer. There's too much cancer. Those are the red flags that if those are in your family, you're really going to want to talk with your doctor. And if they say genetics isn't indicated, you may want to push back a little bit and say, I think I'd still benefit from talking with a specialist, with a genetic counselor, with a risk assessment counselor. I have concerns about the family history. Can we look into a referral? Can I go see a specialist? Now, some doctors have genetic counselors and other specialists within their network, but not every doctor does. And so if you are having a hard time getting referred to one or finding someone near you, there's resources online where you can look for people. So the National Society of Genetic Counselors has a fantastic tool called Find a Genetic Counselor. So if you go to their website, it's www.nsgc for National Society of Genetic Counselors.org. On their very front page, you can see a tool called Find a Genetic Counselor. You can enter your zip code or your state, and you can find genetic counselors near you. That way, if your doctor doesn't know about that genetic counselor near you, you can again help advocate for yourself to get that referral. One thing to keep in mind though is only about 5 to 10%, maybe 20 or 25% of certain cancers is due to genetics. So there's a lot of cancer out there that's not due to genetics. So genetic testing is not going to be appropriate for everyone, but having the conversation is, learning your family history is, and if you're concerned about that family history, even if genetic testing isn't indicated, you can still ask for more information, ask for that risk assessment, ask if your screening needs to be different than the average person so that you are educated and feel comfortable with how your health is being managed.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.